ordeal is just beginning. The ship's arrival coming on a day Wall Street suffered its worst day in 12 years, the Dow losing over 2,000 points. With a spike in coronavirus cases expected, Americans died facing massive change, from virtual classrooms and working from home to growing shortages and, for some, indefinite isolation. Our team has it all covered, starting with Miguel Almaguer.
Arriving under the Golden Gate Bridge, tonight the 3,500 people aboard the Grand Princess cruise ship are finally back in port, but weeks away from being home. With the sick disembarking first, all passengers will slowly file through medical screening.
Whenever you open your door, please make sure you are wearing your mask.
After their doomed voyage to Hawaii turned into a coronavirus outbreak of at least 21 cases, passengers will soon head to quarantine at military bases.
It's kind of nerve-wracking and unsettling that, we're stuck in the unknown and we're at the mercy of the government.
As scenes like this one play out at sea, the State Department issuing a clear warning. U.S. citizens, particularly travelers with underlying health conditions, should not travel by cruise ship. Carrie Sanders is in Florida.
They call this the cruise ship capital. Today, 6 ships leaving the port of Miami. Some passengers say while they're anxious, they're not going to let coronavirus ruin their vacation plans.
While the number of sick in a growing tally of states across the country is soaring, doctors expect a spike in coronavirus cases as more people get tested. Outside Seattle, where at least 22 have died, a drive-through clinic at a local hospital testing dozens per day.
They stay in their cars, they roll down their window, and then we swap them.
Amid a massive run on supplies, universities across the country, including Princeton and Stanford, are telling students to stay home temporarily.
The prompt response is the right thing to do.
Worried that fear is spreading faster than the virus, the CDC says the risk is different in every community. Americans should not panic. 80% of cases won't require any medical care. But those most vulnerable, the elderly with underlying health conditions, should stock up on food, medication, supplies, and be prepared to stay at home. In New York City, the mayor is now encouraging businesses to let employees telecommute, hoping to reduce crowds on the subway. Tonight, a growing effort to contain the virus and manage fear, just as another cruise ship loaded with those who are sick reaches shore.
Miguel joins us now. We see the ship behind you. How long before these folks can get off the ship?
Well, Lester, because there are so many passengers aboard, we're told it could take up to 3 days for all of them to disembark. Many of them will go to nearby Travis Air Force Base for their 14-day quarantine. And Lester, in another indication of just how worrisome the virus has become, the mayor in Boston says they are now canceling that city's St. Patrick's Day parade.
That's a big call. All right. Thank you, Miguel. Now to the growing economic impact of all this and another huge plunge on Wall Street today. The Dow losing more than 2,000 points, almost 8% of its value. Here's senior business correspondent Stephanie Rule.
Stocks today plummeting, triggering a market circuit breaker just 4 minutes after opening bell.
There you see the cessation in ticks on the S&P.
Yeah. Trading began again 15 minutes later, but the market still closed near bear territory. The collapse fueled by the oil price war and uncertainty over coronavirus, hitting some industries harder than others. Air travelers sharing pictures of airports and planes virtually empty, many carriers already slashing routes. Cruise liners are also dealing with canceled plans and ships far below capacity. Many companies already taking action, trying to balance stemming the spread of coronavirus and keeping business afloat. Amazon will pay hourly workers, even those working from home, and is asking employees in several states to work remotely through March. And there's speculation about whether tourist hotspot Disney World will remain open after the company closed certain parks in Asia until further notice. Small businesses are also struggling.
This is lunchtime.
Sam Ip says there has been a 50% drop in foot traffic at his family's Chinese restaurant.
If this continues, I'm not even sure how long I could survive like this.
We need to think about helping hardworking individuals that want to go to work. Some of them are showing up for work and cannot get paid because there's no customers coming in.
And for the millions of Americans who don't have the option of working remotely, like service industry employees and gig economy workers.
I am very scared today, especially today.
The idea of not being able to bring home a paycheck can be daunting.
And Stephanie joins me now. We've been seeing a lot of these roller coaster days, but that was a big drop today. Should we be concerned?
Lester, concern is fair, but it's not a time to panic. We're not facing the financial crisis today. What we're facing is a public health emergency, and the underlying economy is still strong. With patience, we're going to see that strength again. You know, I read something today that said, treat your 401k like you're being told to treat your face. Do not touch it.
That's not easier said than done as well, but your point is taken.
At least not yet.
All right, Stephanie, thank you. There's growing concern in Washington after a senator and 4 House members were in contact with a man infected with the coronavirus. After that, 2 of the congressmen came within close proximity to President Trump. Our Jeff Bennett is at the White House.
As financial markets tumble and the number of U.S. cases of coronavirus climbs, President Trump tonight continuing to downplay the outbreak as the coronavirus crisis hits close to home on Capitol Hill. At least 4 Republican lawmakers, Ted Cruz, Matt Gaetz, Paul Gosar, and Doug Collins, now choosing to self-quarantine after unknowingly interacting with an infected person at the Conservative Political Action Conference in Maryland last month. Collins seen shaking hands with President Trump on Friday. Gaetz seen traveling with the president today. The outbreak sparking new anxiety among lawmakers. NBC's Casey Hunt.
Members of Congress are becoming increasingly anxious about coronavirus, and there's growing pressure on leaders to take steps to protect lawmakers. But House Speaker Nancy Pelosi says tonight there are no plans to change the schedule or close the Capitol.
Meantime, White House officials are growing increasingly frustrated at what they see as President Trump's persistent attempts to minimize the threat posed by the outbreak. Multiple sources tell NBC News. The president's message at odds with Trump administration health officials.
We're helping communities understand you're going to see more cases. Unfortunately, you're going to see more deaths.
I don't think we've seen the worst yet. I think we'll still continue to see more infections.
One source tells NBC News the president thinks his approach is good politics, even though he's been advised to let the experts do the talking.
So, Jeff, what is the administration prepared to do to help calm the markets?
Well, Lester, NBC News has learned administration officials have presented the president with a list of policy changes aimed at limiting the economic fallout of the coronavirus outbreak, including paid sick leave and assistance for the hardest hit industry. Lester.
All right, Jeff Bennett at the White House. Thank you. A growing number of schools and colleges around the country are taking no chances with the coronavirus, canceling classes for days or even weeks in some cases. We get more on that from NBC's Rahema Ellis.
Everybody on their computer right now.
Carrie Hopperstadt's 3 sons are home today. For the next 2 weeks, they'll be learning online.
You get kind of ramping up, learning the technology, figuring out what each teacher is expecting.
Their school outside of Seattle is closed, one of many districts in states across the country that sent students home. In Scarsdale, a suburb of New York City, children will be out through the middle of next week after a teacher tested positive for the virus.
Thinking about the logistics of the next couple of weeks?
The reality of prolonged school shutdowns as a precautionary measure could be crippling. 22 million students rely on free or reduced price school lunches. For many, it's their only hot meal of the day. While health and safety are the priority, it's unclear how much keeping students home will slow the spread of the virus.
You can imagine families where parents don't have paid leave, who are working at relatively low paid jobs, who have to stay home to take care of their kids, and they lose their basic source of support.
Several colleges canceling classes and study abroad programs.
I think everybody's just on edge trying to figure out what's happening.
After someone at Columbia University was exposed to the virus, that school canceled in-person classes, announcing it would transition to online learning by the end of the week.
You think the college did the right thing by suspending classes for these 2 days?
Yeah, I definitely think it was a good idea, especially just to limit the spread within our classes.
The new reality of learning while staying safe. Rahema Ellis, NBC News, New York.
And as the virus spreads, major event organizers and cities face the difficult choice of whether to cancel big public events or go on with them as planned, some already making the choice to pull the plug. Here's Tom Costello.
The biggest high-profile sporting event to fall victim to the virus so far, the BNP Paribas Tennis Open in California, canceled after city officials declared a public emergency. Johns Hopkins University banning spectators from 3 NCAA Division III games. though so far the NCAA says March Madness will go on with spectators.
There it is.
On Sunday, a packed arena for the Celtics Thunder game as all 30 NBA teams develop coronavirus plans. Already, lots of hand sanitizer, elbow, and fist bumps replacing handshakes.
Of course, in NBA games, there are a lot of sweat, there's a lot of collisions, a lot of yelling, a lot of spit that comes out of your mouth in an NBA game, but there's only so much you can do.
So far, the teams insist they won't play without fans.
If I show up to an arena and ain't no fans in there, I ain't playing.
The owner of the Houston Rockets agrees.
I would hope that we would just suspend for a week or 2 weeks or whatever, but you don't want to play games with no fans. That's never going to work.
Meanwhile, some federal trials in Washington state have been postponed. Dozens of conferences canceled, costing local communities millions. Chicago says it will lose 100,000 visitors this month alone from canceled events. San Francisco banning groups of 50 or more from using city facilities. As Seattle, San Francisco, and now Boston cancel St. Patty's Day parades. Health experts urge pregnant women, the elderly, and anyone who's sick to avoid large public gatherings. Practice social distancing at least 6 feet, especially from anybody who's sick. Wash your hands and use hand sanitizer. Lester?
All right, Tom, thanks. We'll be right back in 60 seconds with an unprecedented lockdown for the entire country of Italy as coronavirus spreads. And protecting your family, the main symptom of the virus to watch out for.
The Italian government tonight put the entire country on lockdown. All Italy now a zona rossa, a red zone. Before, the restrictions only applied to northern and central Italy. But tonight, the country that invented the term quarantine told its 60 million people they should stay at home. American Ali Asplin is on a U.S. military base in northern Italy.
But we're just doing the best we can, and the commanders are doing the best they can to keep people calm and give them the information that they deserve to know.
There are those furious at being confined. 6 died in prison riots in Italy. Inmates worried they're locked in with a killer they can't see. Italy's sweeping restrictions came just hours after the World Health Organization came within a hair's breadth of calling this a global pandemic.
Now that the virus has a foothold in so many countries, the threat of a pandemic has become very real.
In Israel, the government announcing all citizens returning from abroad will be put in quarantine. But in China, where the virus originated, some encouraging news. 11 of the 14 emergency hospitals crash-built for the virus are closing, according to state TV. And the number of new cases, says the government, is declining. But the genie is already out of the bottle. Several virologists I've spoken to say we actually have no idea how many coronavirus infections there are because few countries have done widespread testing. But they expect the U.S. will increasingly become a hotspot. Lester?
Richard Engel, thank you. Millions of Americans living in nursing homes and long-term care facilities, and after the devastating effect on the coronavirus in Washington state, many families worry whether they're prepared for more outbreaks. NBC's Jolene Kent has that story.
Tonight, nursing homes across the country scrambling to increase safety protocols as healthcare experts warn that the elderly face the highest risk.
I can no longer sit around and wait for a phone call to tell me my loved one has died.
Families in Washington state still waiting for answers about their loved one at Life Care Center, the epicenter of the U.S. outbreak. 13 residents there have died from coronavirus.
We cannot make any promises that further exposure within the facility is not happening.
1 million residents in long-term care facilities contract serious infections every year. Of those patients, 380,000 die, and that's before coronavirus.
Are nursing homes ready for coronavirus?
I think most are, some are not.
Dr. Noah Marco is aggressively beefing up procedures to keep it out of his nursing facility in Los Angeles, including this tent outside where staff took our temperature and asked a series of questions before entering.
I'm quite concerned that nursing homes will be overstressed by this challenge.
His advice, concerned families with a loved one in nursing care should always ask a series of critical questions.
Did they order hand hygiene? Do they have personal protective equipment? What education are they providing to their staff?
Doctors also advise the best way to make sure your loved one is being taken care of is to go visit in person and ask questions. And if you're not feeling well, just stay home. Lester?
All right, Jolene, Ken, thanks. Our chief medical correspondent, Dr.